The TRASGU study that we presented is a collaborative work from the Spanish National Cooperative Group in Neuroendocrine Tumors, the GETNE group. And this was a study that used our national registry. We have a national registry for neuroendocrine tumors where we have registered over 3,000 patients of this rare disease. This is important for us to learn about the disease. And within this registry, we do specific study asking specific questions. So here we specifically analyze in the TRASGU study the different prognostic or predictive factors for patients treated with somatostatin analogues. We so far have analyzed 300 patients, and we model a number of variables and identified 5 key variables that are baseline variables are present by the time you see the patient, before you know what is the pace of the tumor growth going to be like, and other factors that influence our treatment decisions. And so we modeled these variables and came up with a nomogram that with just 5 variables, including the Ki-67 index, the primary tumor site, whether or not the patient has extrahepatic metastatic disease, the tumor burden in the liver, but interestingly also the neutrophil to lymphocyte ratio. With those 5 simple variables, you can precisely group patients in 4 prognostic groups, which behave very differently and which can be a very useful tool for clinicians to decide whether or not to embark on somatostatin analogues upfront in a certain patient. So for the very poor prognostic group, you may want to really consider other alternative therapy rather than wait several months to see the outcome is going to rapidly progress and do poorly. So, and this was, as I said, the work of many people that collaborate in the trial, and all the modeling was done by Alberto Carmona. I have to acknowledge him, and I have to also acknowledge Paula Jimenez Fonseca, who has done a tremendous work gathering all this data, and of course all the other investigators in the Spanish GETNE group and registry group.